Good morning, good afternoon, and good evening. Welcome to the 447th day of continuous Zoom session of Ifph. Now let us start the program with a silent prayer of 1 minute. Thank you. Today our chief guest is Dr. Yahya, member at Faculty Cell of IHMA, and more than 25 years of experience in clinical practice. We all know that very well, and there is no need of an introduction, Dr. Yahya. And we are expected that he will join soon because of the busy practice. It's a major problem to start the program at 8 o'clock. So the topic of discussion is an important thing, that is the small and medium remedies. In fact, homeopathy has got a lot of medicines. I think sometimes maybe more than any other systems. I'm not sure, but maybe more than any other medicines. Moreover, it is the only one system which has got so much clear-cut literature, very much well-proved and well-written, well-described and well-restored medicines, well-prepared medicines. No other systems of medicine can claim an advantage over homeopathy here, and at least we can say that homeopathy is the number one system in that aspect. In case of the number of medicines, as well as in case of the recordings and the studies conducted on healthy human beings. No other persons except Hahnemann was willing to, even though they all wrote prolifically on the human studies or physiological studies of medicines, but nobody did started that. In fact, Hahnemann was the first person to advocate the medicines in a healthy human being for proving. Well, in the Aforsum 120, well, it's about the importance of the proving of medicines. We have a lot of medicines and well-proved medicines. At the same time, we are often accused of that we don't have scientific medicines. But in fact, Hahnemann said Aforsum 112. Therefore, the medicines on which depend man's life, health, disease, and life and death, disease and health must be thoroughly and most carefully distinguished from one another, and for this purpose tested by careful and pure experiments on the healthy body for the purpose of ascertaining the powers and real effects in order to obtain an accurate knowledge of them and to enable us to avoid any mistake in their employment in disease, for it is only by correct selection of them that the greatest of all earthly blessings, the health of the body and of the mind, can be rapidly and permanently restored. So that much care is given by homeopathy towards a patient. It should be proved very much well proved. And Hahnemann said that the greatest of all earthly blessings is health of the body and of the mind. Not only the body or the mind, but health of the body and mind. Now that we all know about the definition of health: physical, mental, social, spiritual well-being. Yes, this was considered by homeopathy even before 225 years. So that is the most modern system of medicine. And such a method of proving is recorded, and even the name of the persons who proved the medicines were recorded. All are given to the public, not even hidden. As in the case of the other systems of medicine, they don't know who are the persons or where was the clinical trial was done. Now the Supreme Court of India asked the government to provide the details of their clinical trials, the so-called claims on clinical trials, but they didn't, because they cannot give it. We all know that if it is right, then definitely when they were administered as medicine, they will also give the same result. Unfortunately, that never happens. We know in case of this, even in the case this COVID also, there are a lot of medicines, one after in tandem, one after another. HCQ2, the 2DG3, so many medicines are there, but none of them were proved effective when treating on the patients. Because that is a reality, the other one is a myth. even though they claim the scientists. At the same time, what has happened in homeopathy? It was declared that arsenicum album is the most suitable remedy for preventing COVID. Not on base of not mere assumptions, but on the methodology of homeopathy, we can say arsenic album is a medicine. And even after these 1.5 years, it is about to with 2 years, we can still use the medicines. Why? Because of this, the statement of Hahnemann and the method given by Hahnemann. Because every medicine must be tested purely, clearly, without any mistakes. That is very important in homeopathy. Is there any other systems giving such an importance to the proving of medicines? No systems. The Ayurveda system, there is no clinical trials are there. From empirical method, they accumulated some clinical studies, not the drug proving. So homeopathy is the only system of the branch of medicine which uses medicines. Others are using drugs. We are using medicines as well as remedies. So in fact, we have a lot of material medicines. Hundreds of material medicines are there. I don't know how much is the number of the available material medicines now, but from the textbook of material medicine, that is the Herring's Guiding Symptoms, to the latest textbooks. There are a lot of the textbooks. Some of them are compilation works, some of them are original works. All these are done by our brave and honorable members of the proving societies. At that time of Hahnemann, and all on the years, there are a lot of groups are there. It's known as prover society. They are conducting all these works. It's commendable job. And they provided all this record to us. And even after 200 years, we are using these medicines. So this is the beauty of homeopathy and the blessing of homeopathy, so that we can say that homeopathy is the real gift of God, and it is proved by time again and again. We are waiting for Dr. Yahya's arrival. He just informed that he will join in a short time. If anybody is there would like to contribute something or to say something, can raise the hand on this proving of medicines or their experiences in drug proving. Then again, one thing we must add to that, how this much of experiment become possible. What is the reason? Without much damage to the persons who are become the provers. Because of the potentization, the credit goes to the infinitesimal dose, and the potentization is a very important thing. That is also a peculiarity of homeopathy. Well, no other systems of medicine can claim these two aspects, the infinitesimal dose. We all know that now the allopathic medicines are using small doses. For example, in case of asthma, they are using inhalers. A couple of years, around 20-25 years, they are giving injections. Now they are then it is converted to tablets. Now what they are using inhalers. What is the difference in inhaler? The dose is too small dose, but still they can develop. There's still a long way to go because they didn't believe in potentization. They now believe in the infinitesimals. They don't know about the drug proving, but we are all conducting that. Definitely they will reach to the drug proving later. That is the advantage of homeopathy. Then about the topic is the so-called small remedies or small and medium remedies. What is the meaning of these small and medium remedies? Two reasons are there. I think, not my assumption, but as said by Hahnemann, there are two reasons. One is the innate inability of that particular substance to produce symptoms in almost all areas. That's an important thing. We all know that. Why we select arsenic album? Because it is a number one medicine which can create or produce a lot of symptoms in almost all persons unconditionally, almost unconditionally every time. That is the reason. So we all know that a lot of persons advocate other medicines like camphor, sepia, so many medicines tried. Definitely, some of them got some results, but they can't beat arsenic album. because of the innate ability. As Simon said, it's a heroic medicines. They are always producing a lot of symptoms. There are around 3,000 symptoms of arsenic alcohol. It is at the same time some other medicines of the mineral or vegetable kingdom, they may not produce that number of symptoms. So the innate ability of the substance to produce symptom is an important thing. That is why we often use such medicines as small and medium size medicines. A lot of materia medica are there on these medicines. And the second reason is that due to the lack of proving, we must accept that. Who will do all these things? It's a very tedious journey of the proving of medicines. We must suffer a lot because after taking 2 or 3 or 4 dose of medicines, definitely the patient will develop symptoms. Not the pathological symptoms, but the symptoms, function symptoms are there. Yes, Dr. Yahya joined. Yes. Okay, now on behalf of IFPH, I am once again welcome Dr. Yahya. Thank you, and you can have the platform for the next 40 minutes. Thank you, Dr. Yahya. Please make Dr. Yahya as co-host. Yes. Now, please unmute Dr. Yahya. Yeah.
Yes. Can you hear me?
Yes, of course.
Good evening, everybody. I'm a little bit late, so my clinic time is at 8 o'clock. So even then, I rushed. Okay, sorry for the delay. So, good evening, everybody. So, for the IFPH team behind this platform. So, in this session, I would like to continue the rare drugs and medium remedies, so that we already discussed last few weeks back. So the remaining drugs. So for the seniors, it will be a revision, and for the juniors, definitely it will help to recollect the drugs, and for the lovers, it will be a surprise, I think. So we'll start with. Actually, I'm not going to the minute details of the drug. As you all know, these drugs are not well proved, and usually we got the symptoms from the clinical verification or the pathological symptoms. And if we prove these drugs, definitely we will get more and more symptoms which will act even in the emotional and the mental level. So I will just narrate a few drugs, 40-45 drugs. It will be boring, but we have to go through these drugs because sometimes now and then certain drugs will come to your mind when a patient comes to your clinic. So that sometimes it will save. So that only I mean by narrating the symptoms of these drugs. Okay. So as you all know, now this is the COVID era, and you people are familiar with the two drugs which are new, Ancaria tomentosa. Ancaria tomentosa, which we often use for the COVID patients for loss of smell and taste. So Ancaria tomentosa, usually the low potency from 6 to 12 we often use. So that will help to in the case of loss of smell and taste. Usually, even after 2 weeks or 3 weeks, if it persists, definitely this drug will help you to come to the normal stage. Even after 5 days, you can use this drug. So most often we think of Pulsatilla or Cilicia or Bryonia or such drugs will come to your mind. So in certain situations, these drugs will not help, and in that situation, think of Ancaria tomentosa. Another drug which we use is iberthinum. That also in the COVID time, this drug also came to our knowledge and helped in so many cases of pneumonia. For COVID pneumonia, this iberthinum, especially 30 potency, help to a certain extent in so many cases. So this is used as a preventive in myocardial infarction after this COVID-19. So as a complication, so as in pneumonia situations, so if it affects the heart, definitely E. berthinum, the name itself indicates E. berthinum. So the low potency, especially the 30th potency, will help. So when you definitely phosphorus, bryonia, and such antimonium tataricum, that all should come to your mind. But if that fails, think of E. berthinum in COVID pneumonia. Next, I would like to tell you florexin. Florexin. Last time also, I think I mentioned about this drug, which is a curative remedy for diabetes. So the thing is, we often think of in diabetes there is a hyperglycemia. Here there is no hyperglycemia, but there is a glycosuria. So this is a very important point that you have to think. So there is a when you test the urine, you will get the indication of diabetes. But when you check the blood, there is no indication of diabetes. So there is no hyperglycemia, but there is glycosuria. That is the indication of florexin. Florexin. Next comes Damiana. You all people are aware of this drug. It is otherwise known as Ternera. T-U-R-N-E-R-A. Ternera, otherwise known as Damiana. So we people are aware of that we often prescribe in sterility, especially in frigidity of females. Impotency, especially in females, which aids to establish normal menstrual flow in young girls. So whenever there is disturbance in hormones and if there is menstrual irregularities, think of Damiana. So definitely so many other drugs will come to your mind. So if it fails, if those remedies fails, you can think of Damiana, especially low potency, especially that will help to restore the menstrual cycle. The other drug I would like to tell you is urea, which is otherwise known as carbamide, urea. So the indication is renal dropsy with the symptoms of general intoxication. Renal dropsy with the symptoms of general intoxication. There is all the definite symptoms of renal failure, albuminuria, and along with the diabetes mellitus. Whenever there is complication of diabetes mellitus, when the kidney is affected, we can think of urea. So uremia is a major symptom in urea, and so dropsy, and this can be used as a diuretic. This urea can be used as a diuretic, especially in renal failure. So you have to think of other drugs like peace along with the urea. Then Uva ursi. Uva ursi is a drug of choice in cystitis. So pyelitis. So if whenever there is inflammation of kidneys, whenever there is bloody urine, whenever there is burning after the discharge of slimy urine. So you all people are aware of the symptoms of cystitis. So at the close of urination, there is burning pain. So Uva ursi, we can think Uva ursi is a remedy of choice in cystitis and pyelitis. Stellaria media. Stellaria. So Stellaria media. So similar to pulsatilla. This is a very similar symptoms of pulsatilla in Stellaria media. So you people are aware of the rheumatism of pulsatilla, the shifting rheumatism. So in Stellaria also there is shifting rheumatism. So in gouty subjects with affection of finger joints. So worse morning and better evening. The modality is worse morning and better evening. That is Stellaria media. Stellaria media. Ocimum canum. Next drug is Ocimum canum. So you people are aware of Ocimum, we often used in renal stones. So like, along with the lycopodium or a berberis or a sarsaparilla, we can think of Ocimum canum. The indication is right-sided. This Ocimum canum is a right-sided drug. You all know lycopodium is also right-sided. Whenever there is a left-sided affection, you will think of berberis and hedoma. The indication of Ocimum canum is a red sand in urine, like a sarsaparilla, a red sand in urine, and there is a renal colic, and there is uric acid diathesis with the spikes. Urine odor of musk. That is the indication of Ocimum. Urine odor of musk. Side you have to mention along with the lycopodium. It stands side by side to lycopodium in the side affinity. Hedoma already we last time we discussed about the hedoma. That's I already mentioned. It's a left side already in kidney affections, especially in the renal stones. Insulin, low potency 3x or 30, we often use diabetes mellitus, insulin. So in gouty subjects, patients, whenever there is diabetic affection, you have to think of insulin with the subjects to skin lesions like itching, boils, or varicose ulcer. Whenever there is varicose ulcer, whenever there is a dermatitis or itching, or whenever there is skin lesion, in diabetes mellitus, think of insulin. So you people are aware of the diabetic remedies. You have to compare other drugs like already I mentioned fluoxetine. Lecithin is another drug of choice in diabetes. Gymnema. You people are aware of Gymnema, Staphylandra, Uranium nitricum, Cesidium, Pancreatinum, Calmate, Curcuma longa. This is a very important drug of choice in diabetes mellitus, Curcuma longa. So, manjal. Curcuma is a very important. So you people have to think of curcuma whenever there is a failure of diabetes or hyperlipidemia. You have to think of curcuma. So a very effective drug. So I often use now curcuma. It's a costly drug, but you have to buy it. So the comparison of insulin, I already mentioned fluoxetine, lecithin, Gymnema, Staphylandra, Uranium nitricum, Cesidium, Pancreatinum, Calmate, and Curcuma. So the drug of choice in diabetes mellitus. So it's in insulin. So I told you there is skin lesion and gouty subject, you think of insulin. Asoka. Asoka is Jonesia asoka. The full name is Jonesia asoka. Amenorrhea and metrorrhagia. So the drug of choice in amenorrhea and metrorrhagia with the reflex uterine congestion and along with the headache. So there is congestive headache in Ashoka, in amenorrhea. Congestive headache with the amenorrhea, think of Ashoka. The next drug is Myrica, Myrica, Myrica. So often used in hepatitis, jaundice. Tenacious, thick, nauseous secretions and sleeplessness is the main symptom of choice. So in hepatitis, think of Myrica. So we will think of chelidonium or mersol or bryonia, such drugs of when you think. So you have to, along with that drug, you have to think of Myrica in hepatitis. Tenacious, thick, nauseous secretion is the main cardinal symptom of Myrica. Acalipha indica. Next drug is Acalipha indica. So we often prescribe Acalipha indica in tuberculosis. Whenever there is a hemoptysis of, so especially all the symptoms are aggravated at night, think of Acalipha indica. The other drugs you have to compare along with the Acalipha is phosphorus, oripicac, calcareous carb, silicea, iodine. So these are the drugs when we think of primary complex or tuberculosis. Stanamate, you know, so Swedish sputa is the main symptom of Stanamate. So in tuberculosis, if a patient comes with the tuberculosis and if they narrate the symptom, if there is Swedish sputa, think of Stanamate. Like balsamum peru is also drug of choice in tuberculosis. Balsam peru, Coccus cacti. Whenever there is a ropey phlegm in tuberculosis, think of Coccus cacti. Yerba santa is another remedy for tuberculosis. Yerba santa. Whenever there is a night sweats, whenever there is more night sweats, think of Yerba santa. So we often think of mersol and silicea in sweating, and samicus also you will think of sweating. But in tubercular patient with night sweats, so actually this is a common symptom in tuberculosis. But you have to match with the Yerba sancta in TB patients. Calicarb, Drosera, Stricta. Stricta also we often prescribe in TB. So the nature of cough. So that is the comparison. So I just telling about the comparison of Acalipha indica, because so we never think of Acalipha indica in tuberculosis. We often prescribe the constitutional drugs or other drugs I mentioned already. So when whenever there is more hemoptysis with more cough aggravation and night, to think of Acalipha. Next drug is Abroma radix. Abroma radix. Irregular menstrual disorder. That is the indication of Abroma. So you often used for menstrual disturbances. So along with the aleatris farinosa, you have to think of aleatris farinosa, sabina, trillium, ustilago, erigeron, fraxinus, millifolium. So whenever there is menstrual disturbances, the drug of choice, the drugs which comes to your mind is sabina, trillium, ustilago, fraxinus, erigeron, millifolium. So compare these drugs with the Abroma radix. Whenever there is menstrual disturbances in females, think of Abroma radix. Next drug is the eagle folia. AEGLE, eagle folia. So bleeding piles. So you will think of hamamelis or a phosphorus or an axomic or polyxonia or aloes or aternia, peonia. We often think of hemorrhoid remedies. So along with it, so you can add a drug, eagle folia, especially the low potency, the especially tincture will help in to arrest the bleeding. So for to arrest the bleeding, we can prescribe phosphorus or a sulfur or a loose or Remedies. So, the drug of choice is offered from these drugs, but along with it, you add eagle folia also in bleeding piles. At the same time, dropsy and impotency are the other associated symptoms in such patients. There is edema, dropsy, and impotency. That also you can add in eagle folia. Punarnava, the next drug is Punarnava, Borrelia diffusa. It is otherwise known as Borrelia diffusa. Punarnava. It's a remedy of choice in hypertension. Whenever there is elevated BP, think of Borrelia diffusa. So in that case, there is a high blood pressure and there is a dropsy along with the BP. If there is a dropsy, think of Borrelia diffusa. In that situation, you have to compare other drugs such as paracetamol, Adonis, allium sativa, pituitary gland, spartium, spartium scoparium, strophanthus, Crataegus, Veratrum and Raulfia. These are the drug of choice in hypertension to palliate or to when they along with the constitutional remedy. Sometimes you have to think of these drugs: Pareta, Moor, Adonis, Naja, pituitary, allium sativa, spartium, strophanthus, Crataegus, Veratramal. Veratramal is a very important when we see synthesis repertory. The hypertension, you see hypertension Veratrum is mentioned in, I think it is in 3 marks, Veratramal. So, Punarnava. Then next drug is Brahmi. Brahmi, so we often prescribe for a memory deficiency, Brahmi. Whenever there is absent maintenance, think of Brahmi. Carica papaya. The next drug is Carica papaya. So it promotes digestion of those whose stomach can't tolerate meat or milk. So if there is indigestion after taking meat, if there is indigestion after milk, think of Carica papaya. So you people will think of Naxomica or a carbovate or a Sycona or a colchicum. So Lycopodium, zingiber. So along with those drugs, whenever there is digestive disturbance after milk and meat, think of Carica papaya. Ficus religiosa. So Peral and Areal, Ficus religiosa and Ficus indica. So both these are our drugs, Ficus religiosa and Ficus indica. So it's a remedy for bleeding piles, epistaxis, hemoptysis, hematemesis, hematuria, menorrhagia, metrrhagia. See, so full of blood. That is in Ficus religiosa. Ficus religiosa, bleeding, epistaxis, hemoptysis, hematemesis, hematuria, metrrhagia, and menorrhagia. So think of Ficus along with other bleeding remedies like phosphorus, Remedies already. So you people are aware of other constitutional drugs. So along with it, think of Ficus in whenever there is a hemorrhage. Chirata. Are you aware of Chirata? Gentiana Chirata. The full name is Gentiana Chirata. It's an antipyretic. So for a fever, we prescribe Chirata. So initially, when I started my practice, so I often prescribe eucalyptus for fever, Chirata for fever, so Baptisia for fever. Nowadays, I never use these drugs actually. So you should be aware of these drugs. So it is an antipyretic actually. Gentiana Chirata, it's antipyretic. So it's a popular remedy for chronic fevers. So pyrexia of unknown origin. Whenever there is pyrexia of unknown origin, you think of Chirata. Next is Kurchi, Kurchi, Kurchi. The other name is Holerina antidysenterica. Holerina, H-O-L-A-R-R-H-E-N-A. Holerina antidysenterica. So for acute and chronic dysentery, think of Kurchi. Kurchi. Kurchi, Kurchi, or dysentery. For chronic dysentery, so you should think of Mercor, Mersol, capsicum, arsenical, cantharis, sulfur, Naxomica, Podophyllum, aloes, aconite. These are the drugs often we think in dysentery. Along with the Mercor and Mersol, Kurchi also you should note down. Kurchi. Arjuna is otherwise known as Terminalia Arjuna is a disease of the heart with the organic and functional and symptoms. So it's a heart tonic. Actually, Arjuna is a heart tonic, especially tincture or 3x we prescribe as a heart tonic. Angina pectoris, a remedy of choice in angina pectoris. Pain all over the body owing to a fall. So in ecchymosis also we have to think of Arjuna. In ecchymosis, whenever there is a fall, in injuries also you can think of Arjuna. Zingiber, Inji. We all are aware of Inji. Nowadays, Zingiber is often used in Corona time for creating natural immunity. The holistic medicine people often prescribe Zingiber along with the lemon. So you have to think of whenever there is acidity, whenever there is a complaint from eating melon and drinking impure water. So whenever you drink impure water, think of Zingiber. There is a heaviness in stomach with wind, great thirst, diarrhea from drinking bad water, hemorrhoids, hot and painful. There is asthma, worse towards morning, and it's also a drug of choice in renal failure. This is Zingiber is a remedy for kidney failure. Zingiber. Carbovage, lycopodium, Naxomica, colchicum, natrum phos, caribe, caricarol. All these are the drugs whenever there is acidity, whenever there is a gastric disturbance, we think of such remedies. Along with that, those drugs you have to add Zingiber. Next is X-ray. You people often prescribe X-ray in sterility. So the drug of choice in sterility. So in psoriatic people, if there is sterility with psoriasis, so it brings to the surface. So whenever there is a suppressed eruptions, so whenever there is a suppressed discharges, whenever there is a suppressed skin complaints, we can think of X-ray. We often prescribe tuberculinum or sulfur. So in such situations, you can add this drug also for your choice X-ray. Whenever there is a suppressed symptoms, it's a drug of choice in leukemia and leukemia. Whenever there is anemia and leukemia, you can think of X-ray. So sterility, when we think of sterility, the drugs come to your mind is the Agnes casters, thiocinaminum. Thiocinaminum, whenever there is a tubal patency, the fallopian is blocked, we can think of thiocinaminum. So in sterility, thiocinaminum, along with the X-ray, you have to think. Borax also a drug of choice in sterility. Damiana, I already mentioned tribulus. Tribulus is otherwise known as Ikshugandha. That also should come to your mind whenever you treat sterility. Tribulus, Damiana, borax. Borax is a very important drug. Oramet, Sepia, Yohimbinum. Yohimbinum is also a drug to think of in sterility. So, X-rays. Next is Vaidya. W-Y-E-T-H-I-A. So pharyngitis. Then whenever there is irritable throat of singers, so from using voice, so if your larynx is in trouble, think of Vaidya. So you know argentum nitricum, argentum metallicum, phosphorus, carbovate, causticum. These are the drugs often you think whenever there is laryngitis or pharyngitis. So along with it, you think of Vaidya, W-Y-E-T-H-I-A, Vaidya. I think for seniors, this is a revision. This is only a revision. For juniors, definitely you have to learn these drugs, because sometimes in certain situations these drugs will help.
Yes.
Viola odorata. The next drug of choice is Viola odorata. Otorrhea. Viola is, you have to think of Viola in otorrhea. Headache across the forehead. Acts upon frontal sinuses. Dyspnea during pregnancy. That is in the Viola, dyspnea during pregnancy. There is rheumatism of the upper parts of the body, such as deltoid. Carpal and metacarpal joints are affected in Viola. Viola odorata. Viola odorata. Viola tricola is another drug for eczema. Viola tricola, eczema and impetigo. Eruption, particularly over face and head. Whenever there is eruption over the face, we often think of Viola tricola. So Viola tricola and Viola odorata, these are the two Viola types. Cypripedium, are you aware of Cypripedium? Insomnia in children. Cypripedium, yes, insomnia in children. So say Camomilla senna. So we think of Camomilla senna in insomnia. Ophia also in insomnia we often think. So along with it, if there is insomnia in children, you think of Cypripedium. C-Y-P-R-I-P-E-D-I-U-M. Cypripedium. Stigmata myadis. So three organs are affected: heart, kidney, and prostate. This is the combination of stigmata. Whenever there is heart trouble, whenever there is renal affection, whenever there is prostate enlargement, when these three organs are affected, think of stigmata. So urinary symptoms plus organic heart disease. So valvular lesions are there in stigmata with much edema of lower extremities and scanty urine, enlarged prostate and retention of urine. Enlarged prostate and retention of urine. So stigmata. So the three organs: heart, kidney, and prostate. So when this combination comes, think of stigmata. Spartium scoporeum. This spartium also is another heart remedy which often be prescribed for hypertension. And whenever there is heart affection in smokers, tobacco heart.
Excuse me, doctor, how many medicines are remaining, doctor?
So it comes around 45 drugs. So if the time
Yes,
allows,
I think we can have another session, doctor. Very valuable.
yes,
And
yes, we
productive one.
can have a discussion. We can have a discussion, and so many senior doctors might have used these drugs. So I want to know the result after using these drugs, because sometimes in a lifetime, sometimes they may be using this drug in one time. So please, we can have a discussion after, because actually when I narrate drugs and symptoms, it will be boring. That is another thing. But we have to add to our vocabulary, because any new word to your vocabulary will improve your language.
Yes.
Likewise.
Okay, doctor. Then I think, doctor, now
Yes,
we can
please.
go to the discussion round of. Okay. Yes.
Okay.
Those who would like to participate in the discussion, please go to the participant list and raise your hand. Anyway, it's a very productive and a lot of medicines are used and described Dr. Yahya. It indicates how extensively he read all these medicines and how much time he might have spent for this. It's an important lesson for the others also. That's my suggestion. Yes. If anybody is there to would like to participate, please go to the participant list and raise your hand. You all know that homeopathy, the most important thing always is the indicated medicine. That is, the remedy is important, but sometimes this may be very important, very much helpful for us. But in case of contingencies, these are very productive and easy. Moreover, it is very easy to select such medicines without going to so much complications of the case. So it's also very easy. Moreover, when the patients are taking a lot of allopathic medicines or palliative medicines, then these will be very productive. Yes, I think Dr. Hubert is very contented with this presentation of Dr. here. Please, yes. He's always looking for small medicines. Dr. Hubert, yes.
Today,
God of politics. Yes, come on.
Today, sometimes I have some, I could not attend it properly, but I know that he's always saying, new medicine. But kurchi, I can say that kurchi was a very powerful medicine for to control what he said for diarrhea in it sometimes. Some other medicines are, I think that earlier he mentioned these medicines for some medicines I could not attend it properly. So sorry for because between this, the two patients came.
Okay. Yes. That is our high and only mission. Okay, doctor. Now, yes. Please, Dr. Hariharan. Please, doctor, please unmute yourself. Yes. Dr. Hariharan. Yeah.
Okay, dear Dr. Yahya. So, okay, is usually see juniors, when we are coming out of the college, usually we uses this medicine, what you said. Still now, most of all medicines I have used from in my early practice. Now I am not using very little medicines, what you said here. See, actually, he said is correct. See, certain medicines still now I am using. One is Damiana. Damiana I am using for he said for impotency. for headache, I am using very much. Headache, migraine. I think he did not mention that. So for migraine, you can use Damiana, because Damiana has the property to see vasodilator, I think. It's a vasodilator. So it comes under the importance, and see migraine also, it is a very good remedy. Certain medicines I am using still now. See Brahmi, he said is very correct. Brahmi, in olden days, we are Ayurvedic physicians. In our Ayurvedic manuscripts, Brahmi is a wonderful remedy. Still now, a lot of Ayurvedic doctors and homeo doctors are using. I am also using for this Brahmi tincture for the poor memory of the children. I actually one thing I like to say is, under Brahmi there is a vast research in, I think, in USA, and they not established that it have the property to prevent the Alzheimer's disease. So you can mind it. You keep in memory that if you give this Brahmi tincture continuously, we can prevent this. This Alzheimer's disease.
Okay.
In the, see, next I like to say is, see, one interesting thing I will tell you that if you give, see, about 15 drops Kandari's tincture in a half glass of coffee, see, you can stimulate female orgasm within half an hour. It is an important thing. Usually, in veterinary cases, I tried so much cases. I tried, and certain patients also I tried. So it is a clue that Kandari's tincture can do. So likewise, a lot of interesting. See, I will say later. See, a lot of doctors are waiting to participate in discussions. Okay, thank you very much, here.
Yes, doctor. Thank you, Dr. Hariharan, for your valuable suggestions. And I used to take a lot of Brahmi Matanjara in my school days. At that time, to
Okay.
my memory, yes, still
Oh,
remembering.
you got
Okay.
it. Yeah,
Yes.
you got the memory.
Maybe.
Another thing, see, Brahmi has to prevent the petit mal. That is the wonderful effects, Epilepsy, Ayurvedic doctors are using this Brahmi to prevent epilepsy. But in my experience, I usually give it for petit mal to prevent it petit mal. If you use yellow, okay, I am closing.
Yes, now Dr. Anand Jaiswal waiting. Please, Dr. Anand Jaiswal, please unmute. Yes. Doctor, come on.
Good evening, sir.
Yes.
I'm audible?
Yes, of course.
Good evening, everyone. Sir, it's a very wonderful session, and lots of medicine with unique, specific disease is very informative, sir. I want to know about the case, para-effusion, pneumonia with para-effusion, a tubercular case. The patient is on anti-tubercular drug. After the treatment, there is a uric acid level is increasing. They give medicine, allopathic medicine for uric acid, but still not control. In case, sir, shall I be thought about the case with pleurisy and plus uric acid medicine, sir, to control it?
See, benzoic acid is a very good remedy, hypertension, benzoic acid is very good remedy to decrease the uric acid. And you can use one tincture, that is Artica urens tincture. Use it. It will come down.
Okay.
For pleurisy, sir, there is a accumulation of water in the chest, extrapulmonary.
See, 25 drops of Artica urens tincture in half glass of water. You give it. half glass of water and give high potency, see 10 mm potency of acid bends, 1 dose. The uric acid will come down.
Okay, doctor.
Clear?
Answer this all. You got the answer?
Got the sir. For one, there is a accumulation of water. Pleurisy. Is there any medicine, sir? Some tips, sir, for parafusion.
Pardon. The question is not clear.
For pleurisy, what is
For
the drug
pleurisy.
choice? So pleurisy, yes, wet pleurisy.
See, you read, I think, arsenicum tibetum. Please think about it.
Veratrum can be used. Veratrum
Veratrum is
virate.
wonderful remedy. Veratrum 30, if you give half an hourly, certainly it will control the pneumonia. So it is, I think, pleurisy, which I think.
Actually, it is the case of, sir, pneumonia with paraeffusion. The diagnosis by the doctor is it is of tubercular origin, extrapulmonary tuberculosis.
Can you
Anyway,
think
all
about? Can you think about arsenic iode?
Okay,
So
sir.
if you get a few more symptoms, so then you can think of drugs. So otherwise,
Yes.
it will be difficult actually.
Okay.
See,
Now it's Dr. Pranav. Yes, Dr. Pranav, what is your? Yes. Dr. Pranav, please unmute. Yeah.
Yes, sir. Yes, sir. Namaste to everyone here. And it was very wonderful session, sir. And I am not a senior person to comment upon anything, but I have one experience. That is use of Yohobinium, sir. So actually, in our OPD, there was a case of sterility. Premature ejaculation. So I couldn't take the complete case. So once I was thinking about the nearby remedies, so like ashwagandha or damiana or any other polycrust remedies, I was not very comfortable with those remedies. So I just by not impulse, by some good logic, I could come to Yohobinium. So once I had given Yohobinium to that patient in 6C potency for 3 days, within the next week, he came and told that his premature ejaculation was good. But he also confirmed that his hemorrhoid complaint was better. So then I went back to read the literature. It was found that Yohobinium is very important remedy in cases of sterility with hemorrhoidal issue. That was what I wanted to tell. And thank you, doctor, for your wonderful explanation on these remedies, because many remedies I have not heard of, and none of these remedies I have used. So thank you, sir.
Okay. It's a time to wind up the session. I think we can call up Farid Bavakan, sir, to say a lot of thanks. Sir, are you there? Yes, sir. Please say a lot of thanks.
I could enter very late, so I could not attend fully. Anyhow, Yahya, we have got an imagination about Yahya. It would be a very good class and presentation. Anyhow, as far as I am concerned, the most of the explanations were about the medicines and all that, but I cannot grasp much of them. Anyhow, he has made a wonderful presentation on the aspects, and gratitude to dear Dr. Yahya, wonderful presentation, and we expect more from you. Thank you very much. All the best. Thank you.
Thank you. Okay, that is the end of today's session, day 457. We'll be back again tomorrow with another session, another topic. It's now over to Dr. Hubert De Silva for the Malayalam session. Till then, goodbye.